My name is Nicole Hartman. I am a registered nurse in an intensive care inpatient unit in the state of North Carolina. I've recently taken part in a collegiate debate regarding North Carolina House Bill 655, North Carolina Health Care for Working Families. The best argument for North Carolina House Bill 655 is that it provides health care coverage for adults age 19 to 64 at or below 138% of the poverty level. This population is ineligible for health insurance subsidies under the Affordable Care Act. Furthermore, those that fall into this category must prioritize where their dollars are spent, and healthcare falls to the bottom of the list behind food, clothing, shelter, and other important necessities. Providing healthcare coverage for this population would increase access to care in the form of disease prevention and health promotion. That would benefit the state of North Carolina and society as a whole. The best argument against North Carolina House Bill 655 is that it is dependent on federal matching dollars for its Medicaid expansion. It requires that participants be working and contribute towards coverage. The Supreme Court of the United States ruled that states who expanded coverage with work requirements for Medicaid expansion are ineligible for federal Medicaid expansion dollars. This fact would nullify this bill even before it is passed into law. North Carolina House Bill 655 was initially filed on April 9, 2019. It was pulled from the July 9, 2019 House calendar and referred to House Health Committee on September 11, 2019. I believe North Carolina House Bill 655 has much of the needed legislation to expand Medicaid coverage in the state of North Carolina. However, the work requirement will nullify the bill immediately. In addition, requiring participants to contribute 2% of their annual income will again limit access to care for this population, as it is difficult to afford even basic needs when living at this level of poverty. Nursing practice focuses on treating patients and educating patients, meeting them where they are on their journey of health care. The focus is increasingly on health promotion and disease prevention, which are essentially absent for the uninsured population of North Carolina. To provide the expected care ethically and professionally, these patients must be given the opportunity for expanded Medicaid coverage. North Carolina House Bill 655, as it is today, should be stopped. However, this bill could be modified to provide Medicaid expansion without work requirements and without requiring participant contributions. North Carolina House Bill 655, North Carolina Health Care for Working Families, is a great starting point in the conversation about Medicaid expansion in the state of North Carolina. Using many of the positives in this bill could create a comprehensive and fiscally responsible bill providing coverage to those in great need. Many states that previously expanded coverage have found costs associated with expansion were offset by increases in tax revenue related to federal dollars circulating within the state, as well as increased job opportunities in the healthcare sector. If not for the financial reasons, we must look for a comprehensive Medicaid expansion program for those in need because it is ethically the right thing to do for the citizens of our state. In the long run, better health of the overall population will help us all.